Hi, I'm Jasmine Barclay, and I'm gonna be doing a cardiac and a peripheral vascular assessment on you. Um, can you tell me your first and last name
Jordan Richard,
and your age?
25.
Okay, I'm gonna start by assessing your arms. Okay, so can you hold them out for me? Okay, your skin is warm, dry, and intact on both arms. Your hair is nice and distributed evenly on both arms. Can you squeeze my hands for me? Your grips are even in both hands. Okay, next I'm gonna check your pulses. Can you flip your hands over for me this way? I have your radial pulses here and your brachial pulses here. Okay, you can rest your arms for me. Thank you. Oh, let me check your skin turgor. Okay, and skin turgor in this hand. Skin turgor is good. It bounces back very quickly. Okay, and next we're gonna check your carotid artery. So I'm gonna palpate each artery one at a time. We'll do this side first. Look this way for me. Okay, and there was also no distension noted on that artery. I'm gonna do this part for you. Can you look this way for me? Okay, and now I'm gonna listen to your carotid artery, and I'm gonna ask you to take a deep breath in and then breathe out for me and hold it.
Okay.
Oh. Okay, deep breath in and out and hold. Oh. Bells. And breathe. Okay, and we'll do the other side. Deep breath in for me and out and okay, and breathe. Okay, next I'm going to listen to your valves, and I'm going to educate you on where they are.
Yes, ma'am.
Okay, first I'm going to start off with your aortic valve at the second intercostal space. And I'm going to go straight across to your pulmonic valve, second intercostal space. Okay, I'm going to go down to Erb's point at the third intercostal space. And now I'll go down to your tricuspid valve at the fourth intercostal space. And then I will do your mitral valve at the fifth intercostal space, mid-clavicular line. So, okay. I'm going to do the same thing, except I'm going to use the bell side this time. Okay. Aortic valve, pulmonic valve, Erb's point, tricuspid, and mitral. Okay. Now I'm going to get you to lie down for me, and I'm going to do the same thing to your chest. Can you lay down? Sorry. Thank you. So I'm going to use the diaphragm first. So, aortic valve, pulmonic valve, Erb's point, tricuspid valve, and mitral valve. Okay, and I'm going to use the bell side. Aortic valve, straight across to the pulmonic valve, Erb's point, tricuspid, and mitral. Okay. So now I'm gonna check your pericardium area. I'm gonna feel for some tenderness first. So, you feel any tenderness? Okay. No. I'm gonna check for. Sorry. I'm gonna check for any bruising. No bruising noted. No pulsations noted or anything. Okay. So next I'm gonna ask you to roll over onto your left side. So okay, can you come over, Marquise? Okay. Okay, this is the fifth intercostal space. Aortic valve noted. Okay. Next, I'm going to assess your legs. So, I'm going to start off looking at your legs. Your hair is evenly distributed. Your skin is warm, dry, and intact. Next, I'm going to check your pulses. Your femoral pulse. Your popliteal pulse. Your dorsalis pedis, and going back up to your tibial pulse, posterior tibial pulse. Okay. I'm gonna check for edema now. No edema noted in this leg. No edema noted in this leg. Can you sit up for me? Okay. Oh, we got to check your jugular vein distension. I'm sorry. Can you lay that down for me one more time? Okay. Okay. So can you look this way for me? No pulsations noted over here or bruising. Okay. Can you look this way for me? No pulsations or bruising noted on this side either. Okay. Now can you sit up for me? That completes your cardiac and peripheral vascular assessment. Thank you for being my patient. This is Jasmine Barclay. I just got done doing a cardiac and peripheral vascular assessment on a 25-year-old male. We started off with his arms, and they were nice and even, skin warm, dry, and intact. His grips were even in both arms. His hair was evenly distributed in both arms. Next, we went to his radial pulse, and it was even in both arms. His brachial pulse was also even in both arms. No abnormalities noted there. Next, we went up to the carotid artery. I assessed the patient's carotid arteries separately. There was no bruising or palpitations noted with his carotid artery, and they were nice and they were easy to auscultate. Next, we went to the patient's valves, and I educated the patient on where the valves were located. There was no abnormalities noted listening to the valves, no murmurs or thrills, no S3, S4 noted. We listened to the valves with the bell side and the diaphragm side, lying and sitting. I also listened to the patient's mitral valve with him laying on his left side at the mid-clavicular line, and there were no abnormalities noted there. Then I looked at the patient's jugular veins. There was no jugular vein distension noted on either side, no bruising or palpitations noted in the jugular veins. Next, we went down to the patient's legs and palpated his pulses, his femoral pulse, his popliteal pulse, and his posterior tibial pulse and his dorsalis pedis pulse are all normal and palpable. His hair was evenly distributed on both legs. His skin was warm, dry, and intact, and there was no edema noted on either leg bilaterally, and his legs were the same length bilaterally. And that is it. Thank you.